everyone. My name is Nicole, and this is one of my great colleagues, Kelly. We've worked together for several years, actually. We're getting together to just talk about things from a provider standpoint and a patient standpoint. I think today we're just going to just start with an overview and let you know why we got into telehealth, why we're here, why it matters, and how it can benefit you, whether you use me, her, both of us, none of us, on another platform. It's really just a very, very general conversation. So Kelly, if you want to introduce and get into why you started telehealth and how you got here and what the heck's going on.
Well, great. Thanks, Nicole. I am Kelly White. I'm a family nurse practitioner, and I've been in medicine, gosh, I guess total now for about 20 years. I've been a nurse prac for coming up on 17 years. And telehealth is a great opportunity. What was a great opportunity for me whenever I left brick and mortar. And for people that don't speak our lingo in telehealth, brick and mortar just means like an in-person setting in an office, in a hospital setting or whatever, which is kind of where I was. I spent the first several years of my career right out of school. I jumped feet first into an OB-GYN office setting. I worked for 3 very busy obstetricians.
Oh, wow.
We were so busy. And I had a first assist right out of school. So that's the other thing about nurse practitioners is we don't have the ability to go into the operating room like PAs. You know, PAs are taught in school to assist in surgery, and we're not. So I got my first assist right out of school and immediately went into the OR. So I was assisting like C-sections, all of the gynecologic surgeries. It was a blast. I was in my 20s. So, you know, like all the energy in the world, right? You know, blowing and going and, you know, running across parking lots, helping to deliver babies, tons of fun, right?
I love it.
And I, you know, about 7 years into that, transitioned from OB-GYN into, of all things, neurosurgery. So as some of my friends said, I went from one end to the other.
And that's how we connected, because we're both in the OR, but I'll get into mine later. But that's how Kelly and I connected, was actually through, wait, you did neurosurgery? Wait, I did trauma surgery. And so it was just really cool.
Yes. And so the way that kind of happened was the female obstetrician I was working for at the time knew I was ready to kind of transition. I was kind of getting burned out, not by my patients. I adored my patients. The grind became a little too much, and I was ready to just do something different. And that's a great thing about being certified in family practice. You know, we can do anything. We can do anything from babies to geriatrics, like anywhere in between. And it gives us the opportunity to do that. So she's good friends with the head neurosurgeon in town. And so she and I had chatted, and she knew I was ready to move on. And so she called up her friend, and he was ready to add another provider to his practice. And so I moved into neurosurgery. Whole other world, but I love the OR so much. It was just, it was fantastic. And I spent 7 years in neurosurgery, and I just loved it. But then COVID happened, and I realized that somewhere along the way, I turned 40. Like, I don't know what happened, guys. I got old. And you just quit being able to run and gun and go and do. And I, you know, 5:30 came earlier and earlier every day, and rounds at the hospital before surgery every morning early, and then rounds after surgery and clinic. And it just got and then COVID happened, and I just got completely burned out. My husband got sick. My daddy got sick. Life happened. And as some of you guys can kind of relate to, we in healthcare took a huge hit. You know, Nicole probably has a story about this as well. But for me, my story was I left neurosurgery. I furloughed during that time because when COVID happened, our small hospital kind of central hub. We take care of 19 counties out here. And so we became the hub for everyone. And as we filled up with COVID patients, we had no empty beds for post-op patients. So we quit operating unless it was in a life or death situation. Yeah. So I furloughed from the office and went back into the ICU where I had experience to help out with COVID patients.
I did too. Yay.
It was the biggest tail kicking of my life. Like, it was so traumatic. It was emotionally exhausting, physically taxing. Like, it was a lot. And it opened my eyes to a lot of things about medicine and everything. And so healthcare, we took a hit, all the pictures that you guys see online of, the people with the little
It's real. It's real.
It really is real. And I have eczema and I have it on my face. And so it was exacerbated by those masks. And I legit was breaking out and bleeding, and I had all the things and I was exhausted. So after all of that happened, I couldn't transition away from it, and I just became exhausted. So emotionally, I couldn't do it anymore. And my husband needed me, my family needed me. And so I made the hard decision to just walk away from brick and mortar, walk away from the hospital. And so, but as Nicole can attest to as well, when you're like us, you run 1,000,000 miles a minute, and you don't really know how to stop. And so I literally went from 1,000 miles a minute to a halt.
It's true. It's true. We live in a constant state of chaos, and that's how we function. Like, I don't know about you, but like I function very well under pressure. Yes. And that's a lot of times I'll procrastinate until it's the last minute. I'm logged in at night submitting an assignment at 11:50 because that's just how I do things. Like, it's hard. Like what you're talking about is we live with the gas pedal down, like 100%. And then it's to come to that stop. Maybe we'll get into it one day, but there's an emotional loss to that. Like it's hard. It was hard for me. I'm sure it was
hard for me as well. And I struggled. I went to work for a company that was doing well in the beginning and then just became a sinking ship. Nicole, that's where you and I met. Mm-hmm. Then they sold out to another company, and it was just, I learned a lot though. I mean, I know you can attest to this as well. I learned a lot about telemedicine during that time, and it afforded me the opportunity to really hone my skills in telemedicine. But because I was needing that rush, I jumped into a leadership position, and I was helping them write protocols and do all the things. And
but you're very active with that.
Very active. And I caught myself logging in on my days off, on my time off, and helping out and doing all the things. And I let it turn into a bad behavior, because that's the bad side to telemedicine is you have to learn to respect your space in your office at home and leave that door closed when you're off work. And
if you don't, people are like, oh, you work from home. No, I live at work.
Yes.
Like, there's a difference. And if you don't, like you're saying, you had to draw the line. If you don't draw that line, you will very easily, like Kelly's saying, get into that. Okay, I live at work. I don't work from home. I live at work. And so that's so real.
It really is. It really, really is. And so I was learning how to turn that off, and it became really hard. And so it taught me that it's okay for me to take that time back, and it's okay for me to say, these are the hours that I'm going to quote unquote work. And the rest of the time I can give back to my family, and I can spend time with the people that I care about and give back to myself. And so it was a hard lesson. It's a really hard lesson. It's really hard when you have to start practicing what you preach, start doing the things for myself that I start telling my patients. But unfortunately, that's kind of what it came down to. And so through all of this, the brainchild of my private practice, Kari Health, was born. Because I literally hit ground zero. I hit the bottom. I was struggling. And so Kari, by definition, in the Greek and Latin language, means strength, resilience, and courage. And I chose that name for that reason, because those were the three things that got me back up and going.
I love it.
And so Kari Health was born. And my slogan is that I'm meeting you where you are. Literally meeting you where you are, whether that's physically in your home, in your car, at work, at your kids' daycare, at soccer practice, wherever you are. I'm meeting you exactly where you are, because that's the most convenient for you. And you're meeting me where I am, which is in my home, which is my safe space now. And so that's kind of where telemedicine was born for me. It was born out of a necessity, one, for my emotional well-being, but at a time when, thankfully, a pandemic allowed this to become a thing. And it gave me the opportunity to give back to my patients in a way that I didn't realize was going to be emotionally and spiritually beneficial for me, as well as for my patients.
That's awesome. That's awesome. I know, I, in a next episode or, following episode, I definitely want to get into more detail of what services you offer, because you offer very completely different services than what I offer. And so we do want to talk about that, in future podcasts. So you'll have to stay tuned for that. But
So
I mean,
tell us about you,
uh,
Nicole. What got you here?
so I come from emergency background, ICU, ER, RN. I got my nurse practitioner 6 years ago, and I did a year of internal medicine. And I had to do internal medicine because I felt like out of school, I could run a code in my sleep. But I felt like, how do I manage gout? Like, manage it, like not treat it acutely, but like manage it. Like, I was so good at emergency right now in a hurry, but handling those chronic conditions was definitely something strange to me. And so I needed that. I knew I needed a good, solid, full-time year of managing those conditions, managing the diabetes, and not everyone needs an insulin drip, right? Not everyone is in diabetic ketoacidosis, like how to manage it to keep it from getting that bad. So I did do a year in internal medicine. And then my stepmom passed away, so I moved closer to my dad, and I took a leap and applied for orthopedic trauma surgery job.
Wow.
And I was hired. I had the emergency background. I was a volunteer firefighter in my very early 20s. So then ICU, ER. So I had that emergency background, but I had never been in surgery before. And so they did train me to do that first assist. So back when you were doing it, it wasn't something we could do. But as nurse practitioners, autonomy and positions have evolved,
Mhm.
I joined this group. It was great. They trained me how to be an NP first assist. And so that's what I did. And, it was the taking call. It was, nobody plans a gunshot wound, right? So, it was a really, really fun time in my life. Huge learning curve. Wasn't something I'd done, but it was amazing. And so, because as nurses, I'm sure you can relate, we always have a side gig, right? Because we're
Or
always like,
three.
or two or three, right? So this is like, we like nurses gauge time, like, okay, if I want to go on this vacation, how many extra shifts do I have to work? Like,
Yes.
like that's how we man it. Like that's how we plan our life. How many shifts do I have to work? So we're always hustling, right? And so we thrive on that adrenaline. So I was like, okay, what can I do as a side gig, but something that's not too demanding, because I am taking trauma call. I am working, nights, days, rounding, all of this other stuff. So, and in the office, in the clinic. So one of my girlfriends says, hey, I started this was in 2019, before COVID, before any of that. She's like, hey, I'm doing this telehealth thing, and I'm making, a little bit of extra money, like 500 extra bucks, maybe a month, $300 to $500 an extra month, but it's super easy. I can do it with my phone. And she's like, you should try it. And I'm like, all right. And so I started doing telehealth, and if I made a couple extra $100 a month, I was excited because it was like super quick and super easy, sinus infection, UTI, things like that. That's just, whatever. And I could do it from my phone. And then I was like, all right, well, I'll get a couple more licenses. So I got a couple more state licenses, because we can't practice nationwide without being licensed in those states. And then COVID hit. And I was like, all right. So then they had the emergency licenses open up, which meant that the states came together and said, we need help. If you're licensed in another state, you can practice in our state for this emergency situation. So we were able to practice and help urgently sick patients in most of the states, because there was a lot of states that opened their borders to say help. And so that is what, I get goosebumps. Like, that is what drove me from there to, okay, who can I help that's in a rural city, out in the country, that needs help, or their doctors are closed, or, you know, the ER is overflowing or whatever, like holy moly, like I can help so many people doing this. And so obviously we knew the emergency licensing thing was going to expire. So I started working on getting permanent licensure across the nation. And during that time, and so as those emergency, rules have since lapsed, I was able to continue to care for patients across the nation. So during COVID, I did do what Kelly's talking about. It's so funny because I was like, okay, I need to do my part because I'm an ICU nurse. Like I'm still a nurse. I'm a nurse practitioner, but I'm still a nurse, right? So I felt like, okay, I have to do my part. And so I did take a leave of absence from being a nurse practitioner and went and took a COVID assignment at the bedside in the ICU. And just like you said, it kicked your tail. It kicked my tail. Totally kicked my tail. I was like, oh my gosh, like,
you realize you're not 20 anymore.
Hello. I feel like, yes, I'm like, okay, I am in my 40s. Like,
same.
Like this is whoa. And I was doing night shift, which is not easy to begin with, but it was terrible. And we can get into the horrors of that another podcast. But how I got here is that COVID pushed patients to realize if you're sick and you have 3 kids and you can't get to the doctor, use telehealth. I see patients sick from their bed all the time. Like now it's not just about those rural communities. It is primarily, but it's also about people who don't have insurance, people who are uninsured, people who don't have transportation, people who whatever, like, yeah, people who don't want to leave their home. They don't want to go sit in a waiting room. It's time saving. I can treat you, send you a work note for what your condition is, and you can go on with your life. Like there's so many different things that we can do now, but it has pushed me. And so eventually I started, as I got, busier and busier, I started cutting down my hours because I love trauma surgery. I love it. I love it with my whole heart, but it comes a point where you have to go where you're needed. And there's such a huge need out there right now for patients, underinsured, whatever the case may be, that need help, that I eventually went down to part-time. Then I went down to 2.5 days a week. Then I went down to 2 days a week. Then I did 1 day a week for probably almost a year, where I just wanted to keep my hospital credentialing. I just wanted to touch patients. I wanted to keep that connection, but eventually I telehealth squeezed me out. I mean, it's just became, I had to make a decision, right? Am I going to hang on to this for XYZ emotional reasons, or do I need to let it go because I really need to just put everything that I have into telemedicine? And so eventually I did that. Last November, that was the end of in person, and the need is so great. It's just what I had to do. And, I'm very, very strong in my faith and trying to hear, where I'm supposed to be and what I'm supposed to do. And, even going through a nurse practitioner school, people would say, well, what are you going to do? Well, I don't know, wherever God puts me. I don't know. I don't know. Yeah. And so it has taken me on a wild ride, Mr. Toad's wild ride. It's got nothing on me, but that's how I got here. And so Kelly and I have worked together. We've definitely connected over our emergency background, but it has been, I can definitely relate to we are so used to being on 100 and coming down. No one should be coming to us that is emergent. That's not what telehealth is for, right? So it's hard to come off of that. No one's going to die, like, because that's where we lived. Like, that's where we know is if I don't intervene, someone could die. Someone's going to die. And so coming off of that for me was super, super hard because we are helping people at their most needed moment, at the most crucial moment in their life. And now we're providing a completely different service, which the rewarding of it is very different. It's still rewarding, but it's very different. It's very, very different. So that's something that I still continue to struggle with. Still to this day, I still struggle with that.
Yeah. I think that we've had to, or I know I have for sure, Nicole, is learn to shift my mind from the reward for me is now knowing that I saved a mom a trip to the pediatrician's office. I saved somebody at work who didn't have PTO and couldn't take the day off to go to the doctor's office. That opportunity, they may have, their employer may have said, you leave work, you're fired. But they're sick and they need help. They can take a 15-minute break, walk outside on their phone and text me or call me. And we can do a quick visit and I can take care of them. And so I think, it's like you said, you have to learn to shift your mindset of knowing that that reward is still there. It just looks very different. It's packaged very differently for us. And so we know that telemedicine certainly serves a place. We've just had to learn to shift the way that we feel about that reward that we get. And I know for me, it has still become something that I'm so passionate about, because at least now, especially with Kari Health, learning to meet someone where they are is now my drive. Knowing that I can take healthcare to that person and meet them right where they are becomes so rewarding for me.
I love that. I love that.
Knowing that, I can stop, especially in the height of flu season, or especially in the height of, like around here, gosh, this year, I don't know about you, Nicole, but for us down here, I live in Texas, and storms this year have been insane, absolutely insane. Neighborhoods are getting wiped out. Convenience stores are getting wiped out, and people don't have access to their pharmacies, don't have access to different stuff. And so it allows me to fill a service that maybe is missing because of these storms, or maybe they have illnesses that they wouldn't have before. We've had so much rain down here. I have patients that are, have certain allergies or upper respiratory exacerbations that they didn't have before. My asthmatics are having problems breathing and having things because of the mold that's growing and stuff. And so it helps me to at least be able to know that because I have a telemedicine practice, that person can still come to me without the downtime that they would have of taking the whole day off to go to the doctor, or waiting in line at the urgent care clinic and sitting in a waiting room full of sick patients, or even knowing that they don't have insurance and they're afraid to go here, there, or somewhere else.
Yeah, for sure, definitely. I definitely feel like there is such a purpose for it. And it's funny because sometimes I'll get patients that have done it for the first time and they'll be like, okay, this is so cool. This is so cool. And I'm like, I know. Yeah. They're so cute when they're like that, when they're really just like, this was the easiest thing. Oh my gosh, you have no idea what kind of time you just saved me. And I'm like, here I am. And
they're like, what, you can write me a prescription? Absolutely. Absolutely.
Yeah.
You can send it to my pharmacy? Absolutely. Wait, you can write me a doctor's note? Absolutely. Like, I have a fax. I can send you a doctor's note. Where do you need it to go? Like, we can do all the things, short of a few things. I can't touch you. I can't lay hands on you. But telemedicine has come a long way. We can do a lot of things for our patients, and it's fantastic. We can take care of their prescriptions. We can take care of their doctor's notes. We can take care of so many things that get them back up and running, and they've missed 10, 15 minutes of their time as opposed to 2 or 3 hours of their time.
Yeah. I get a lot of patients too that, and some employers are ridiculous. And I'm just going to say this, and I don't care if it's controversial, but some work employers will want a doctor's note. Now, I get it. At some point you have to have some kind of regulation, and I get that, but some of them request doctor's notes at the drop of a hat. And it's like, that's part of the problem here. If my patients know, humans know, if they have a sinus infection or if they have body aches and they think they have the flu because they've been around someone with the flu, they don't need to necessarily go to a doctor to tell them that. Like, why should they go spend their time and money, resources that are unneeded, just to get a note because I know I'm sick? I was around someone with the flu. My kid had the flu. Now I have it. Why do I have to? I know what I have. Like, it's such a waste. And so a lot of times I'll see patients and say, look, I was sick with the flu. And I can tell when someone's ill, and I need a note because I don't need to go to my regular doctor and sit there for 3 hours, or I can't even get in until 2 weeks. You know, I don't
Yeah.
need to go waste the urgent care or ER to get a note. And so that's something that is really handy that we can do, because we can just email you or fax whatever you need. Like, we can send you the note that says, please return to work. You know what I mean? In other words, you know, instead of being brick and mortar, thanks for wasting my time. Your patient was ill, blah, blah, blah. Here you go. They can return to work. Like, come on now. Like, what
Exactly.
comes, you know, help us help you. Like, you know.
Exactly. Or heaven forbid, because they are exposed, you want them to go sit in line at the urgent care clinic and expose everyone in the waiting room.
Exactly. Exactly. Is that what you want them to do? Like, people, I feel like they just don't think it out. Like, if somebody's missed 3 or 4 days, okay, fine. I get that. But like, at the drop of a hat, I do get a lot. No, my employer just wants a note. And I'm like, all right, this is ridiculous. Come on now.
For sure.
But anyway, something we could do that is super, super helpful, you know, and like Kelly was saying, you know, we are board certified in family, which means we can see pediatrics we can see everybody, right? So I did the family because I knew if I wanted to go into emergency medicine, I would need to see pediatrics. And so that's why I did family, because I wanted to have that option. I didn't want to leave out that option, because you can certainly be a nurse practitioner and just do adults. But for Kelly and I, we're used to, you know, just handling whatever we need, you know, just because somebody's 16, they're considered a pediatric, but we still want to be able to treat them. So
Exactly.
yeah, so that's how we got here.